Good morning, everyone. Welcome. My name is Kristen Tobin. I'm the Associate Dean of Student Affairs here at NECO. On behalf of our faculty, staff, students, and Board of Trustees, we'd like to welcome you to NECO's White Coat Ceremony. I also want to welcome those of you joining us via live stream. Thank you. I know there's people out there as well as all of you joining us here in person. Just a couple housekeeping items. If you could take a moment to silence cell phones or any other devices, that would be greatly appreciated. Please refrain from using any party favor, noise makers, confetti, anything like that. Thank you. I also want to encourage you to take photos and videos of your students, but please do remain in your seat. We are providing professional photography and recording that will be available to your student after today's event, so they'll have that as well. So at this point, we'd like to welcome our students. Thank you again, and we will get started. All right, should we dance or sit down? Why don't we sit down? I love the song choice. I think that came from your class. We've had a couple more slow songs, so thank you for giving us up on stage an opportunity to jam a little bit while you're here. Well, good morning again. Thank you again to everyone for being here. Today, we are celebrating NECO's White Coat Ceremony, and we're recognizing a few different classes of students, so I just want to make sure I share that. We're recognizing the four-year OD class of 2028, the accelerated OD class of 2028, the Advanced Standing International Program class of 2027, and the MSOD China class of 2027. So thank you all. I just want to start out with a couple brief words, and I'd like to start with the students. First of all, congratulations. Today's a big milestone in your journey, and I hope you're proud of how far you've come. In my role, I've had the privilege of getting to know you, even starting early in the admissions process, seeing you at orientation, and then watching you move through your first classes and months here at NECO. I can tell you, watching you kind of progress to this point in your journey and then continuing on is by far my favorite part of my role. To the families, friends, supporters here today, thank you. Your encouragement, your love, your patience have helped these students reach this moment, and we're so glad that you're here to celebrate with them. Students, receiving your white coat marks a turning point in this program. What will come next are new challenges, opportunities, and yes, even final exams next week. I hope you still find a way to celebrate today. Before you rush ahead to what's next, I hope you'll pause and really be present in this moment. As you probably know, I tend to talk a lot about my own children, so the mom and me couldn't help but throw in a Dr. Seuss quote quickly before I finish up today. He once said, "Sometimes you will never know the value of a moment until it becomes a memory." This is one of those moments, and you earned it. Congratulations again. We're so excited to walk with you through what's ahead. At this point, please help me welcome one of my favorite people, President Dr. Purcell, to join us and share some words with you. Thank you.
Good morning, everyone. I have to say, this is always a wonderful occasion. I can't stop smiling, and the pride that we feel, I think, is only surpassed by the pride that you all feel in supporting your students. So thank you all for being here. Good morning and welcome, students. Today is a very special day in your career, the next phase of your journey, patient care. I want to recognize all those joining us today, family and friends who play such a critical role as your support system. Thanks to all of you. Today you will receive not only your white coat, but also your clinical privileging letter. This allows you to know truly live the mission of the college, changing the way people see the world. You'll have an opportunity to contribute and learn at our community health centers, VA hospitals, and NECO-owned clinics. You'll have a rich, diverse clinical experience, and we hope you'll continue to remember the importance of giving back, that over 2.5 billion people in the world do not have access to vision care. I also want to make sure you remember the power of the white coat. That coat you're about to put on, it's not just about the fabric of the coat, but it's a true symbol of trust. Never take that for granted. Be curious. Ask questions. You're going to make mistakes, and that's okay. This is the time to do it. Don't expect perfection, but take advantage of every opportunity that you have to learn from the incredible faculty and clinicians that you'll have a chance to work with. One day, all the decisions you're going to make will be the right ones because there'll be nobody looking over your shoulder. Learn from every patient. Treat patients like family. You'll never go wrong. I always remember my first patient, and you'll all remember yours. And in the end, it's really truly about being a good communicator. How can you communicate and build that trust and confidence in your patients and your patients have in you? I'd like to offer you a few additional points to remember. The commitment that you make to patient care and compassion. The importance of empathy and compassion. I'd like to remind you that your role goes beyond just diagnosis and treatment of eye conditions, especially today. Understanding patients' concerns, providing reassurance, and delivering care with sensitivity. Don't ever forget the profound impact compassion can have on patients' overall well-being. I hope you'll embrace lifelong learning, always evolving as a person and a clinician. Always remembering your ethical responsibilities and the importance of integrity. Trust and respect, that's what really results in better outcomes. Collaboration and teamwork is so critical. You'll be in environments that will enable you to maximize that opportunity. The value of working collaboratively with others in the healthcare profession is so critical and has been so critical to our profession for so long. Foster strong professional relationships and appreciate the interdisciplinary nature of healthcare. And probably most important of all, your own personal well-being and balance. Acknowledge the demanding nature of the optometric profession and the importance of maintaining a healthy work-life balance. I encourage you to prioritize your own well-being, seek support when you need it, and develop strategies to manage stress. Remember, your ability to care for others is linked to your own health and happiness. Strive to make a difference. That's your impact. Strive to give back. That's your responsibility. Strive to be the best you can be. Strive to always care. I promise you, patients can tell. I don't know if you remember, but during the interview process not all that long ago, I asked you all to think about what type of doctor you wanted to be. That the time to begin thinking about it wasn't today when you're walking across the stage getting your white coat, but who are those influences you had? Think about the best doctor you ever had, and I hope you've been thinking about that, because every experience you have from now on will shape that for you. What kind of doctor do you want to be? Strive to always care. I promise you, patients can tell. I was at the Mass Commission for the Blind intern graduation ceremony, and Janet Lebrecht, a wonderful, amazing person who's been on our board, and when you get into the clinic, you'll see the Janet Lebrecht Center for Low Vision Rehabilitation. She's a past commissioner of the Rehabilitative Service Administration, just a wonderful individual. And her comment really struck me, and I want to make sure I share it with you. She said, "The pathway to prosperity is through experience. Now is your time to make your mark." Our next two speakers were both an instrumental part of your first year at NECO and were chosen by you to represent you at the White Coat ceremony today. I'd like to introduce Dr. Benjamin Young, Associate Professor of Optometry, who will be followed by Dr. Jennifer Riley, Associate Professor of Optometry. Dr. Young.
Thank you. Hi, everyone. Thank you so much for having me. I'm really honored to be here. Congratulations. As we said, this is a milestone moment. It really represents all the long and tiring work that it takes to practice and the even longer work of studying for all of your tests. The white coat itself is a symbol. It's a symbol of a lot of different things. It's knowledge, it's hard work, but ultimately it's trust. And I know Dr. Purcell was mentioning that earlier, and I really want to highlight that today, because it's more than an item of clothing. It's a responsibility to patients who put their faith into you. The white coat is ultimately a symbol of the weight of the word intern, that transition that takes place when you go from the classroom to then the exam room. And I think glaucoma is a really good example of that, of the trust that patients have in us. Because a lot of times what we do is we go through this whole process of we check their vision, we look at their scans, and we do a visual field testing, and we become like 100% sure that they have glaucoma, right? I tell everybody that. I need to be 100% sure that you have glaucoma before I start treating you. And we're super proud of ourselves in that moment, right? And it's really important because we are giving them medication that's going to prevent them from losing their vision permanently. But the thing is what the patient is hearing is that I know that your vision seems fine, but I need you to take these drops anyways. And it's complete trust that they have in you. It's trust without symptoms that they have, and ultimately faith without proof. If there's one guiding principle that drives you, let it be this: treat the person, not the disease. Implement standards of care, yes, but always do your best to see the world through the patient's lens and adjust accordingly. A moment I had with a patient last week, or I guess 2 weeks ago now, reminded me of this. I told him that he doesn't yet show signs of advanced age-related macular degeneration. Most people are happy with this information. They take their glasses prescription, and then they leave. This guy seemed a little bit skeptical. He was like giving me this side-eye kind of look. So I went into a little bit more detail than I usually do. Scrolled through the retina scans, showing him the normal anatomic landmarks on the OCT. I reviewed the changes I would expect to see if the disease was present, and explained the difference between stage 1, 2, and 3, and 4, according to the AREDS 2 trial. After telling him that he barely met the qualification for stage 2 macular degeneration, I suddenly noticed that tears were falling down his face. He hugged me, laughing and crying at the same time, and told me how relieved he was that he didn't need intravitreal injections like his mother, who now only has light perception in both eyes. It struck me then that sometimes the best care that we can give a patient is the reassurance that they are not actively losing their vision. And it is ultimately the trust that they have in your knowledge base and competence that makes a moment like this so powerful, because they are literally putting their blind faith in you. There's also no such thing as the optometry police. No one's going to come rappelling through the ceiling and then making sure and arresting you if you do something wrong or if you miss something. Make no mistake, though, your integrity and choices matter. Yes, consequences exist, and our profession holds us accountable through licensing boards, peer review, and standards of care. But the foundation of the trust that you're given by patients is an inference that you are doing what is best for them and holding yourself accountable every single day. I've talked a lot in class about the value that you have as an optometrist, your ability to determine a patient's true BCVA, justifying a reduction in vision with correlating ocular pathology, and the psychoanalysis of refraction. But it is your ability to empathize with your patient, putting yourself in their shoes, trying to feel what they feel, that will keep this profession strong and ensure that our work is not replaced by autorefractors, fundus cameras, and machine-based learning. Finally, this may sound a bit prosaic, but if in doubt, chat with your patients about the weather. I have found over the years that no matter what race, religion, or walk of life, people love talking about the weather. But seriously, ask patients about their hobbies, their family, their vacations, and show them that with your shared humanity, that the inherent trust that they have in you is justified through the way that you treat them and change the way that they see the world. Congratulations again. It's truly an honor to be part of the process of seeing you transform to the doctors that you will be one day. Thank you.
Thank you, Dr. Young. It's a little bit humid today. And good morning, everyone. Thank you all for this opportunity to be here. You all look so amazing. I'm so used to seeing everyone in their scrubs and labs, so you all clean up very nice. So I have the privilege of teaching the foundational principles of optometry to first-year students and into their second year at NECO. In this role, I get to spend a good amount of time with each class, and I get to know many of you individually and your personality as a group. Your class, in particular, has been a fun group who works hard, has a good sense of humor, and above all else, you have been very kind. Each of these characteristics will serve you well in the clinic. I have watched you come so far since last year, when in the early weeks we discussed patient privacy and acquiring visual acuity. Take a moment to think back on how far you have come and how much you have learned this past year. There certainly have been challenges, and patient care will bring a new set of challenges. Remember, though, as the saying goes, that smooth seas never made for skilled sailors, for comfort is the enemy of competence. It is good to be challenged. That is how we develop true mastery. But more importantly, clinic will bring a lot of really great moments. You will help determine a glasses prescription that allows a child to see well in school for the very first time and achieve their potential. Watching a child light up when they get their first pair of glasses is a feeling that never goes away. It's the best. You will assist in treating amblyopia and improving vision. You will give somebody their first contact lens prescription or reading glasses. You will help to preserve vision by detecting conditions such as glaucoma, diabetic retinopathy, and age-related macular degeneration. It is safe to say that you will make a difference in the patient's lives. And it's wonderful to be part of a profession that does that for so many people each and every day. Remember why you came to optometry school in the first place, and lean on those fulfilling moments whenever challenges come along, as they will. My hope now that I see you off from your first full year of optometry school is that you trust in your knowledge and skills that you have learned thus far, and that you never forget your why, the why you came to optometry school. I know that you are prepared for the next level of patient care. I have been watching you all year. You are ready. Good luck, and I will always be here cheering for you. To speak on the duty of care, please welcome Dr. Timothy Bossy, Senior Director of Owned Clinics and Outreach Affiliations, and Dr. Amy Moy, Senior Director of Health Center Initiatives and Optometric Compliance. Thank you all.
Thank you, Jen, or Dr. Riley, I should say, and thank you to our students, families, friends, and everyone for being here today. It is an honor to celebrate this important milestone with all of you. This ceremony marks a pivotal moment in your career as you move forward into the clinical system. Dr. Moy and I are here today to discuss several elements associated with the duty of care that you take on as you receive your white coats. The weather comment, by the way, is perfect. I sat there just thinking about how often that happens, and a perfect conversation to have. But back to the duty of care. To keep your patient's eyes, vision, and general health as your #1 priority. It's easy to focus on examining your patient's eyes and move on to your next patient and look at their eyes as well. However, part of our duty as an optometrist is to consider the whole patient and their overall well-being. You are a part of the bigger picture of keeping your patients healthy, both physically and emotionally. Always remember that our #1 focus should be on our patients.
Hi everyone, long time no see. We just had orientation and I'm happy to see you all looking so great today. The second element is to respect the rights and dignity of your patients and their healthcare decisions. Our patients are individuals who have diverse and unique needs. One management plan does not fit all. You've learned the foundations now in your classrooms, in lab, and now's the time to tailor what you've learned to each patient. Imagine that during an exam you find that a patient has cataracts. You know that cataract surgery would significantly improve their vision and quality of life. However, the patient strongly declines the referral for cataract evaluation. You take the time to respectfully listen to their concerns and show them diagrams of what the surgery entails. Upon further questioning, the patient is scared of surgery and they have a neighbor who had a bad outcome. This is a situation that could be frustrating because you know how much they would benefit from having the procedure. However, we must respect our patients' decisions. Our opinions as doctors does not negate someone's own beliefs. Examining real patients will make you realize that the same formula does not apply to everyone. Let's all see each patient as an individual human being during their time in our exam rooms.
The third element is to strive towards improving access to eye care for all. As you transition into the clinical environments, you will encounter new challenges that you will work through and overcome. These challenges are not always related to how accurate your final glasses prescription is or your tonometry measurement. There may also be challenges presented to you that involve social determinants of health. As a student, there were several times I think back about developing a transportation plan for a patient because they had an emergency eye condition and needed to get into the city. Sometimes you can't always anticipate these changes or what role you'll have in them, but as you work through these challenges, self-reflect, and gain more clinical experience, you will become more adept at handling any situation that arises. Something we celebrate very often, but NECO has partnered with community health centers for more than 50 years to provide eye care for all. You'll be joining this team, and we wanted to say congratulations on being a part of this impactful legacy, improving access to eye care.
The fourth element is to maintain your practice in accordance with professional healthcare standards. It's easy in the first few years after graduation to feel on top of the world of optometry. You know everything because you've studied so much. It's sure to stick in your head, right? Well, I can tell you that after more than 2 decades, sometimes I forget, sometimes I learn new things, and I keep reinforcing what I need to know for my patients. Optometry in healthcare will change and evolve, and it is our responsibility to do the same. You will do this through continuing education lectures, reading articles on your own, going to conferences to learn and network with your peers, pulling out Dr. Young and Dr. Riley's notes again. It is our responsibility to practice standard of care to ensure we are at our best while protecting our patients.
The fifth element is to promote ethical and cordial relationships with all members of the healthcare community. Healthcare is not a solitary journey. It requires consistent teamwork and collaboration. Imagine you have a 45-year-old patient in your chair who has new onset headaches and was diagnosed with migraines by their primary care doctor. You examine the patient and decide to perform a visual field test, which reveals patterns consistent with a neurological condition. When you discuss your findings with the primary care doctor, they recognize the importance of collaboration with optometry. You've earned a nice referral source, and most importantly, you've made a positive impact on your patient and perhaps saved their life. Your upcoming clinical rotations will expose you to the benefits of interprofessional collaboration and the positive impact that it has on patient care outcomes. We encourage you to ask questions, seek others' opinions, as this will further your knowledge and decision-making process.
This is the last element. The last element is to uphold the dignity, honor, and integrity of the optometric profession. Whatever profession with whom we interact, we represent optometry as a whole, and you represent NECO as you go out into your clinical rotations. You may be asked at some point in your rotations as you're walking down the hallway what school or profession you're from. We know that you will make us proud. From today on, you have a duty to the patient first, but also to yourself and your profession to be the best doctor you can be. We hope that in caring equitably for your patients, you'll also find deeper meaning for yourselves. We are so immensely proud and grateful to be able to celebrate this milestone with you and your families today. As your instructor for the second-year patient course, I'm excited to see you begin to develop into outstanding optometrists. Thank you, and NECO proud.
Thank you, Dr. Moy and Dr. Bossy. At this point, I would like to introduce Dr. Eric Weisberg, our Vice President and Dean of Academic Affairs.
Hi, everybody. On a day meant to celebrate your achievements in taking this giant step forward, I, like many of my colleagues, I'm sure, sort of pause and think backwards and think about our time in school and in the position that you're in now. And I think with the benefit of hindsight, kind of consider those lessons that I learned on what it takes to be an impactful optometrist, And of course, remembering who taught me those lessons, which not surprisingly were the faculty. And sure, they teach you the content needed to be a good clinician, the knowledge base, the clinical skills. But if you pay attention, and you pay attention carefully, they'll also teach you the attitude and the approach and the emotional acuity and the swagger that really, in some ways, is more important in how you make patients feel during the process of providing care for them. So some of you may not remember, but during first year orientation, I give this little talk about what it takes to be successful at NECO. And there's a lot I mention. How much you're going to change over the course of the first year, how you're going to take a pause, stand back, and think about how your head has been swollen really with knowledge, how the concept is that you basically have learned a new language over the past year. And I also mention the idea that not only do you learn a new language, but you develop a new voice. And it's this voice that you use when you see patients. We all have our doctor's voice. You can't stop it. It's like optokinetic nystagmus. You look out the window, your eyes move, you will throw up, you will pass out. So don't try to stop it. Just let it happen. Literally, we sound different when we step into this clinical provider role. And during that talk, I mentioned, I'm not going to talk about it now, but I'll circle back and maybe give my theory on why that actually happens. So I'm going to do that now. At that point, you have not developed your new voice, but I bet you're starting to kind of get the sense that you are now. I think that the different voice we use is a result and a tangible reminder of the different person that we've become. The different version of ourselves that we are when we step into that room and are trusted with the visual health of a patient. When you're doctoring, compared to a non-clinician version of yourself, you're wiser. You know more in that room than compared to the person you're talking to than probably anywhere else in your life. Now, you have all that knowledge that they don't have typically. You're more thoughtful, largely because you're making decisions about somebody else's well-being instead of your own, and that carries a lot more weight to it. You're more patient, right? Because you understand that the person that you're trying to help might be nervous, right? And part of the process is allowing them to get that out. Even though you might kind of already get a sense for what they're going to say and what they might have, they still need that time to say it. You're a better listener because you know that more valuable than the clinical test that you're going to run are the words and the information that you're going to get from that patient. And you're more selfless, right? You're more altruistic than that non-clinician version of yourself because you know you're here for them. And sometimes that's going to get in the way of your own life. So non-clinician you has needs, and you should prioritize those needs. But clinician you always puts the needs of the patients first, even if it's not always necessarily kind of feels fair. The voice is part of that outward persona, right? It gives the patient confidence. It makes them trust you. It puts them at ease. And actually, in some situations, it masks some of the thoughts or feelings that non-clinician you might be having at that moment, the horrible day that you might be dealing with, the heartache in your own life, right? It's all gone when you step in that room. And I think the voice kind of helps with all that. So this is something you undoubtedly will hear countless times during the course of your education, and you've heard it today many times, the idea that the patient comes first. We hear these words, they mean something, but there's always a point in our careers that there's an event or an experience, and these words come to life, and we realize what they really mean and what they really mean to you in your sort of quest to be an impactful optometrist. So if I may indulge a little bit, I'm going to step back and tell a little story about when I actually kind of had that experience. So it was the late 1900s, 1993 to be exact. I was sitting in a similar place to you, at least educationally. It was my first patient encounter, my first full patient encounter. I want to paint the picture a little bit, right? time has not necessarily been so kind to me, but at that point, I looked like I had maybe just turned 16, all right? I had a spectacular ginger mullet, saddleback shoes, because no one told me not to wear them, and a very crisp, perfectly white pressed white coat that I had recently received. And my first patient was a 24-year-old male. They came in. They were a hockey goalie, said they were rubbing their eyes a lot, maybe having some trouble seeing. And, I went through everything, got to refraction, and things just started going off the rails, right? 1 was 2, 2 was 1, better was worse was the same, right? Sweating, things are not going as planned. What was I doing wrong? I could not get this patient to see 20/20, right? So I probably refracted him for a good, what felt like 40 minutes. I don't know what it actually was. But after, of course, chatting with them about the weather, spinning the dials for a while, I gave up, right? And I made my way out to the preceptor to expose my shame, right, and not doing a good job. And I went out there and I started explaining. It took the preceptor about a second, right, to bestow knowledge on me. She said, it's probably keratoconus. Go do topography to confirm it. And of course, it was keratoconus. We did topography. We confirmed it. Preceptor, kind of pushed me off to the side a little bit at that point, took over the exam. I sat there, tried to, keep my composure to some degree, and explains everything to the patient. Patient leaves, and I'm left there with my thoughts. And I make my way back sheepishly to the preceptor with every excuse I could possibly think of for what I did wrong and all of that. And it took the preceptor about 1 second, right, to bestow wisdom upon me. And she said, stop thinking about yourself. Right? Think about the patient that just left the room with this scary word for a diagnosis, with an uncertain visual future. Right? It's not about you. And that was my moment. I was like, damn, I actually feel worse, but what an amazing message, right? And from that day on, I never really forgot that. Where I was consumed with how this patient encounter reflected on me, she understood what was really important. It was how it impacted the patient. Sure, recognizing keratoconus will make me a better doctor, but thinking about the impact on the person, will enable me to provide better care. And that was a pretty important lesson. Honestly, I am not sure what my doctor's voice was like that day, but pretty sure it was pretty high and squeaky, if I'm to guess. So although we come together as a community, right, to rightfully celebrate your accomplishments, all of this in the end, as you know, is not about you, right? It's about the patients that we're committing to serve. So instead of saying congratulations, let me say thank you. Thank you for putting in the hard work to get here so you can help people, because it's noble, it's important, and if you do it right, it's entirely selfless. So let's take a pause for a second. All right, we're going to move on to the good part. You all been waiting, and officially get you those white coats that we've been referring to, that you're all holding in your laps right now. So your classes have selected specific faculty to participate in the ceremony today. So at this time, I'm going to ask Dr. Jen Riley and Dr. Ben Young, to my left side of the stage, NECO's version of Benifer. And I'd also like to invite Dr. Purcell to join me. You're just Dr. Purcell on the right side of the stage. The faculty know what I call you. So it's my privilege to now recognize your classes and their achievements so far. So as I call your name, please come forward to officially receive your white coat. Kevin Chen. Brian Cobo. Jungping Hu. Osama Osiratin. Jared Farrier. Yang Nguyen. Pyle Odedra. Soma Ramsundar. Sofia Segrera Rojas. Elham Shams. Raviraj Singh. Raven Sinathambi Saska.
Just unbutton them.
Jolene Andrus. Lydia Anthony. Miranda Arujo. Lindsay Eleni Aruda. Natasha Ashtiani. Richard Avila. Iris Batista. Erin Siebel Benson. Matt Berlin. Harshmeet Bhatti. Samantha Bishop. Tiana Borley. Christian Kaleo. Kaylee Cameloni. David Cantero. Kira Cow. Shia Celia Carlstead. Sophia Chesta. Estefany Changwu. Navidya Cheravari. Oliver Choi. Ahona Chowdhury. Timothy Kloss. Caleb Cleverly. Rachel Cooney. Claudia Cotto. Christina Croft Lopez Del Valle. Danielle Diascoli. Catherine Damrin. Sydney Dana. Catarina Maria da Silva. Margaret Deason. Avery DeMerchant. Nikki Desai. Cherry Darwin. Jaskaran Dinsa. Brianna Rose Donlin. Kiara Duguay. Ivy Fitzgerald. Javen Gill. Nolan Gingrich. Peyton Hamlin. Brooke Hampson. Madeline Hart Pomerantz. Lauren Howe. Emily Lauren Hurst. Amy Ho. Brittany Ho. Emily Hunter. Leslie Inawazo. Gayatri Karam. Devin Kelly. Vaniza Khan. Maxim Kafetz. Evan Kalar. Annie Langkos. Michelle Lee. Chloe Minju Lee. Nicole Lamond. Catherine Liu. Chelsea Liu. Alexa Lombardo. Isabel Mund. Kevin Wynn. Tauvi Wynn. Tiffany Wynn. Tran Wynn. Valerie Wynn. Priyanka Nurmalan. Francisco Noguera. Victor Odomuku. Grace Kelly Oralo. Melissa Ota. Eleni Panagiotis. Poonam Parekh. Mira Parker. Krutarth Patel. Mahi Patel. Ritik Patel. Saloni Patel. Hallie Pelche. Brittany Fawn. Elizabeth Petrolo. Michael Pizzuto. Virginia Prevo. Isha Rajiv. Sarah Ralph. Jackson Roth. Tyler Raleigh. Hannah Rubin. Pallavi Saharia. Kumba Sengari. Holly Lauren Scheiber. Kaylin Schmidtke. Emma Schultz. Regan Seymour. Shelja. Robert Sheffield. Amelia Slilepchevich. Samuel Soers. Catherine Stanislawski. Nicola Stenzel. Katrina Straub. Tracy Sue. Naomi Suter. Erica Nicole Leitner Taylor. Kate Madison Teplitsky. Toksha Thielen. Maddie Thompson. Michaela Thompson. Jaden Tran. Linda Tran. Heidi Abel Vandenbosch. Michael Vong. Annabelle Wang. Dandan Wong. Avery Want. Valerie Winyuwangse. Natalie Yang. Nebi Johannes. Grant Zimmerman. All right, congratulations, everybody. Dr. Cassell.
You all look terrific and wear those jackets very comfortably, I can tell already. Congratulations. On behalf of all of us, the leadership of the college, our faculty, our staff, congratulations to all of you on earning your white coat and your clinical privileges. Wear your white coat with pride and compassion. Never lose sight of why you do what you do. We're all extremely proud of each of you. This is why we all do what we do. Remember what the great Martin Luther King Jr. said, intelligence plus character. That's the goal of true education. Congratulations to each and every one of you. Make the most of the opportunity you've earned. And on behalf of myself personally, everyone's told sort of their personal stories. It's a very special day today. I hope you will take the opportunity to enjoy it with your families and friends and significant others who have supported you along the way. And once again, on behalf of all of us at the podium and everyone involved at NECO, congratulations.
Thank you, Dr. Russell and everyone. I don't know, people don't do selfies anymore, but will you humor me with your white coat? Ready? Do this side. Yeah, woo! Looking good. Yay, thank you. I'm totally going to get made fun of for that, but that's work. All right, well, thank you all again so much for being here.